Right, next one is the stress. Okay, we're nearly finished now. Right, I'm sure everyone feels stressed out at some time. I mean, living in the 21st century is stressful. Right, symptoms. There's lots of symptoms of stress, and some of these you may have, and you aren't really suffering too badly with them. But you know, I think probably everyone can identify with something here. But depression, anxiety, anger, sort of changes in behaviour can be certainly the symptoms. Both mental and physical symptoms you can experience. So things like, there's difficulty sleeping and the tiredness, chest pains, pins and needles, and even cramps. When it's getting really bad, when you really feel stressed, you can actually start feeling the tension in your body. And what the body is doing, it's producing a hormone called cortisol, which is your fight and flight hormone. So sort of the trouble is with stress, you can end up being stressed all the time, and our bodies are designed to be able to sort of release this particular hormone so that you're going to be efficient when you need it, when you're running away from an animal or something like that, for thinking back to caveman days. But if you're stressed all the time, that hormone being produced all the time is going to have symptoms in your body. So you can feel dizziness, restlessness, breathlessness, the chest pains, the pins and needles, and the cramps. And also, it can affect how your bowel functions. And that can then lead to constipation and or diarrhea. So all sorts of things happen then. Right, long-term consequences, high blood pressure. These are all related to the high cortisol levels. That then leads to cardiovascular disease, heart attack, stroke. You don't want all that. That can then also lead to diabetes because your pancreas isn't working as well with the insulin production through the cortisol. Irritable bowel syndrome because of the digestive problems. You can end up with that. And again, reduced immunity. So you don't, it just has a knock-on effect on all those systems. So, how do you manage this? Right, so make time to relax, okay? Right, force yourself to relax. Listening to a CD, having a nice long bath, a massage if you're lucky. Talk to a friend, a colleague, or life coaches. Life coaches are popping up all over the place, and they're actually very useful. Some people find them, and they can't talk to anybody else, but they can talk to a life coach. Basically, get it off your chest. Talk to somebody who's not part of your stress, it's not causing your stress. Find a hobby or a distraction. It could be a sport, collecting stamps, anything that's going to absorb you, take your mind off your problems, even for it's a few minutes. Exercise, coming up again. Again, that's really good at just helping you to produce the happy hormones, the endorphins, and that can help with the stress. Eat a healthy diet, mention this again, all on there. Get 7 to 8 hours of sleep every night. Obviously, that's going to help. If you actually can't sleep that long, then actually resting in bed will also be helpful. And avoid the physical stresses, so things like junk food, toxic chemicals, EMS, which are electromagnetic fields, so things like your mobile phone. Do you need to be on your mobile phone all the time? Do you need to have it right near to your body all the time? Because that is actually giving you extra stress onto your body. So trying to minimise the use. Just use it when you really need to. Right, so just summarise now. So, eat a healthy diet with added nutritional support. Now, I'm a nurse. I've actually done a diploma in nutrition. And one of the things that I have learnt over and over again is that our diets today, no matter how healthy they appear to be, do not have enough vitamins and minerals in them for us to be able to live healthily. So you do need to take some kind of a supplement, preferably a multivitamin and mineral supplement. If you want to stay well, that is essential today. And I personally have been taking these sort of things for about 9 years now, and I've never felt so well. I just turned 50, and when I was 40, I felt much older than I feel now. And that was just about the time when I started to find out about this. So you do need to try and incorporate that into your daily routine. Drink 2 litres of water, and as I said, more in summer because you're using up more fluids. You're sweating out more fluids. Take regular exercise. Get sufficient rest and sleep. Get fresh air every day. And lastly, have a good laugh. So have a good laugh, because it really does. Because it sends out the happy hormones. It does you good. So try and find a way of having a good laugh. And this is this lamp leaflet here. So this contains just healthy lifestyle recommendations, healthy diet recommendations, and you can get it from my website, which is pulsescreening.co.uk/downloads.html, or just go onto the website and you'll find it in the site map. So I'm going to be around during the breaks. So if you'd like to have your blood pressure or a cardio check, now some of you had this done last year, and some had good results and some had bad results. But it's a good way of knowing where you are in your arterial stiffness, whether it's stiff or whether it's nice and elastic. Also, I do your blood pressure as well. So if you fancy having that, then I should be outside.
Ladies and gentlemen, put your hands together for Sue Bedford. Thank you very much, Sue.